I wanted to touch on endometriosis today. It's not unusual for young women, middle-aged or older women to have some kind of chronic pain or chronic pelvic discomfort. Endometriosis is one of the leading causes of that, and I see it most often in young women. It tends to decrease as a woman ages, but a lot of times these young women that come in and have really bad periods or discomfort with intercourse, they're told, well, by their mothers usually, that, oh, your mother had that same thing, or the doctor says your mother had that same thing. The mother says, hey, I had that same thing as you have, just take 2 Advil and use a heating pad, and it's okay if you miss school, or it's okay if you're miserable and don't want to go out with your friends. It's not okay. We've advanced, and I think it's important to evaluate a patient, talk to them. The young women don't even have to have an exam. We can do an ultrasound through the abdomen. I can talk to them. I can feel the abdomen. And with that, that's generally enough information to see whether they might have endometriosis or not. If I am concerned about that, I think doing a laparoscopy and looking and making a diagnosis so that you can tell the patient, here's your options. Otherwise, if you don't look, how do you know how to best treat the patient? You're going to end up just giving them Advil, and that young woman is going to suffer. So I think it's really important to talk with the patient, look with an ultrasound, make sure there's nothing else going on. And if you think it might be endometriosis, offer a laparoscopy. You can make the diagnosis, and at that time or a point in time in the future, the endometriosis can be treated, and that woman can have a much better quality of life. So you look at a laparoscopy, maybe 3 days, 4 days of recovery, but you can give that woman back 3 or 4 days every month for years just by having a laparoscopy, having a downtime of 3 or 4 days. She's not going to suffer for 3 or 4 days every month after that if you're able to diagnose endometriosis or her problem. So I think it's a good investment, and it's something that I would say, come and talk to me about if you're suffering and miserable every month.